I'm Sachin Gupta. I'm a neurotologist at Swedish Otolaryngology specialists. I focus on disorders of the ear and skull base. My particular interests are in management of hearing loss, cochlear implantation, and acoustic neuroma surgery. When a patient comes in, typically I've reviewed all the records they came in with. I will sit down with the patient and really hear their story, because in my field, everybody's goals and expectations are very different. So I really try to approach them with a lot of humility and just hear their story first before I approach all their different treatment options. So Swedish is a hospital that serves a very large population, and we serve patients not only from the Seattle metro, but also even patients in Alaska and sometimes places like Montana and Idaho. Because of that, we tend to see a large variety of pathology, and so that enables us to have a lot of experience with problem solving and approaching patients of all different walks of life and all different expectations. Something unique that I do as a neurotologist is I approach middle ear anatomy endoscopically. And what that means is I use long cameras called endoscopes to enter the ear canal and then do all my surgery in the middle ear using an endoscope. What this provides me is wide visualization of the middle ear and the ability to do the surgery often entirely through the ear canal without having to make an incision behind the ear. I like it because it shortens my operative time, but more importantly, the patients have less pain and they tend to return to work much faster after the surgery. We have a very highly experienced group of audiologists, and the neurosurgical team is also highly experienced. So the combination of all these people put together enables us to deliver very high quality care at the level of many of the academic centers that I personally have trained and worked at. And so I think what Swedish offers is really strong access to care and availability, as well as very high quality level of care for sometimes very difficult problems. I think what's the most impactful for me and what I do on a daily basis is seeing just the amount of gratitude that patients have. It's fairly common that after patients get their hearing restored, they will be in tears, or they just can't seem to thank us enough. And it really is what keeps me going at the end of the day.